Welcome back our fans. Temporomandibular joint part 2. 4. Temporomandibular joint capsule. The fibrous capsule of the mandibular joint is attached to the articular surface of the glenoid fossa and eminence superiorly, and to the neck of the mandible inferiorly. The TMJ capsule maintains proximity of the joint parts during function. It is lined with synovial membrane which secretes the synovial fluid into the joint cavities. Vascular supply, superficial temporal artery and masteric artery. Nerve supply, posterior part of the capsule from auriculotemporal nerve. Anterior part from the masteric and temporal nerves. V. Temporomandibular joint ligaments. 1. Temporomandibular ligament. A lateral fan-shaped layer originates from lateral inferior surface of zygomatic arch, outer surface of articular tubercle. It converge obliquely downwards and backwards and insert at the back of the mandibular neck. B. Medial fibers. It arises on the crest of the articular tubercle and runs horizontally backward and attached to the disc on the lateral pole of the condyle. It prevents backward displacement of the condyle. 2. Accessory ligaments. A. Sphenomandibular ligament arises from spine of sphenoid bone and is directed downward and inserted at mandibular lingula at the lower border of mandibular foramen. It is a suspensory ligament. It limits the jaw movement at maximum opening. B. Stylomandibular ligament. It extends from the styloid process of the temporal bone and insets on the posterior border of the mandibular. It prevents excessive anterior shift protrusion of the mandible during extreme opening. Vi. Synovial lining. The synovial layer lines the fibrous capsule. It serves to form synovial fluid. The upper and lower joint cavities are bathed in a viscous synovial fluid. It provides lubrication of the joint components, nutrition, phagocytosis, and immunological capacity. Muscles of the mandible. Muscles of mastication. Temporalis. Masseter. Lateral pterygoid. Medial trigoid. Kinematics of the mandible. In normal rest position, closed mouth, the antero-superior articular surface of the condyles are pulled towards the posterior slopes of the articular eminences. The thinnest part of the disc intervenes between these surfaces. The posterior band of the disc overlays the superior part of the condyle. The central part of the disc lies between the anterosuperior of the condyle and the articular eminence. The anterior band of the disc lies anterior to the condyle. Separating the teeth slightly is achieved by pure rotation of the condyle within the confines of the disc. Hinge movement. During this movement the disc rotates posteriorly on the condyle. On opening the mouth, the inferior belly of lateral pterygoid muscle contracts. It pulls the condyle downward and medially. The disc follows the condyle due to their attachment with the collateral ligaments. On opening the mouth there is complete body shift of the condyle anteriorly. However, the disc lags behind the condyle due to the pull of retrodiscal lamina. Classification of temporomandibular disorders. 1. Myofascial pain dysfunction syndrome. 2. Disc displacement disorders. A. Anterior disc displacement with reduction. B. Anterior disc displacement without reduction. 3. Dislocation subluxation. 4. Degenerative joint disease, e.g. osteoarthritis. 5. Ankylosis. 6. Neoplasms. 7. Infections. 8. Fracture condyle. Diagnosis of TMJ disorders. 1. History. 2. Examination. 3. Radiographic evaluation. 4. Arthroscopy. 5. Radionucleotide imaging, bone scanning. 6. Electromyography. 7. Laboratory investigations. Thanks for watching. Support us by likes and subscribes.